Thank you for joining us on TVC Breakfast. Now, the House of Representatives wants the federal government to initiate a national policy on drug abuse as part of measures to reduce the abuse of illicit drugs amongst the youth. The decision followed the adoption of a motion on the urgent need to sensitize Nigerians on the danger and widespread use of methamphetamine on youth. Methamphetamine, also called crystal meth, is the most abused drug in the southeastern part of the country. Now, this is why a lawmaker from Imo State, Mr. Henry Nwauba, who sponsored the motion at the Green Chamber, wants urgent action taken to curb the menace. Popularly called Mkpuru in the East, crystal meth is said to be highly addictive and capable of destroying a person's mentality. It keeps its users awake, depriving them of sleep, making them react violently, and taking a toll on the physical look of its users. Well, with me in the studio for more on this is the Executive Director, Christ Against Drug Abuse Ministry, Dr. Dokun Adedeji. Good morning. Thank you for joining us.
Thank you for inviting me.
Now, the issue of drug abuse, before we get to the decision of the House of Representatives, has become a concerning one because there has been a similar increase in its abuse. And a lot of Nigerians are wondering, are we having another pandemic on our hands with regards to the abuse of substance and with the recent rise in the abuse of methamphetamine, especially in the East?
You know, the thing that always baffles me about us in Nigeria is we wait until the latter end of things before we appreciate what we're in. I can say this, and it's being shown from what we've seen. There's a drug epidemic in this country, and it's been there for a while.
This bad?
Absolutely. Look, let me tell you, a survey was done by the UNODC in 2018. The result was published in 2019.
Right.
To show the substance use or abuse in the last year. That survey shows the global prevalence use of substance that was 5.6. Nigeria's own was 14.4.
My goodness.
Which is almost triple the global average. And that figure translates to about 15 million users. And unfortunately, at that time, the highest used substance being abused was cannabis. About 11 million Nigerians were abusing cannabis. You see, the thing about Mkpuru or whatever it is, methyl crystal, is just to show us, to stand in our faces. So you say, look, this is what we've been ignoring. And to say that it's probably the most abused drug in the southeast or whatever, it's neither here nor there.
Right.
The thing is because the House of Representatives probably went to his constituency and he saw the abuse, or he heard about it.
No, in fact, the videos are all over social media.
They've been there. They've been there. You see, the thing is, are we as Nigerians going to begin to open our eyes and be observant of certain circumstances in our country?
Oh.
Look, it even got worse during the COVID pandemic because people could not go and they were concocting all kinds of substances to use. And you know, the thing is, I'm glad with what General Marwa is doing and standing in our faces, showing us a carelessness.
Carelessness?
Carelessness.
We were careless. At what point? How?
Let me tell you.
Right.
How many times do we hear about substance abuse being discussed? How many times do we see people on this area and we castigate them, we compartmentalize them and say, area boys? Do we understand? We don't even understand. It's easy for us to stigmatize people who do substances. Look, of all the 15 million Nigerian people who do substances, only about 380,000 have problems in using those substances. So it's not as if anybody who uses drug would be a derelict, would be somebody walking on the street naked. No, it's not true. They are functional users. They are social users. They are experimental users. You know, so until we come to that realization and see that, look, it's something that we need to deal with as a people. And then even understanding the dynamics of how these things are happening. It's not just to sit in the House of Rep and speak just like that because...
That on it's not enough.
It's not. It's how much of cooperation, how much of financial backing, how much of legislative backing are they going to give to the efforts of NDLEA? We say NDLEA should do this. Their law does not permit them to do most of the things we want them to do. We are so carried away with interdiction that drug demand reduction is nothing. And that is where we should be going. Or else in another 5 years, we'll be overwhelmed. Can I tell you this? Out of every 4 users, 1 is a female.
Right, yes.
So, hey, tell me another thing. Did it happen overnight? It didn't.
No.
It was an insidious thing that we neglected to our own peril.
We'll come back to this aspect of neglect, how we got there and in what aspects specifically. But let's look at what is the cause, what is at the heart of this increase in the use of abuse or in the abuse of substances, especially in this part of the world. Because looking at the figure you mentioned earlier, it's alarming.
You know, it's just like in medicine. People, when we begin to put significance on detection, on diagnosis, we suddenly say, oh, there's an increase. It's underlining. It's been there. But because of sudden touch of saying, hey, what is happening here, then we see an increase. True, there's an increase. But if you say the causes, there are many causes behind it. Availability of those substances.
Easy access.
Easy access. And then affordability. Because what the suppliers or dealers have done is to make sure if you cannot afford this so much expensive, they can give you something in between. And then so it's there. And also greed, corruption. You see, when Buhari talks about corruption.
On whose part?
Everyone. Can I say, why I say everyone is this? Last year, the NDLA found a container of tramadol at the port. If NDLA was not probably on the watch out for it, or maybe following intelligence report, the container would have entered Nigeria. And they said if those tramadol tablets were distributed across the Nigerian population, each Nigerian will have 3 tablets. How did he get in here? Lately, about 2 months ago, the NDLA circulated something. I'm on a committee of the NDLA, and they circulated somebody imported machinery into this country, agricultural machinery. The dog was sniffing that there was something in here. They dismantled it. They didn't find it until they went into the engine. And then they found out that around maybe what the coil or something, they had lost drugs in there. So you can imagine, who did that? A Nigerian. They say there's pre-shipment. Yes, there can be, but it depends on the connivance. And it's also, those are the things that we need to begin. Our value system is almost dead. And because the only thing we venerate is money, opulence, and I say like Americans say, follow the money. If we don't begin to follow the money in this country of all these suddenly rich people, we find that we're just singing the praises of people destroying the system. I'm not saying every rich man is a rogue, but can we follow the money? When you ask the Nigerian, how did you make God? I thank God. Well, where was God with me? That didn't give me your kind of money. You see, so we need to wake up all around. That's the only way we can put legislation. But if the young people, I was in a town, I won't mention the place, about last weekend. I took pictures of 10-year-olds that are already on drugs. It's on my phone.
10 years old.
I can show you on my phone when we finish the program. I took pictures with them. 10. And they said to me, there were about 200 of them scattered all over that town. Who do it? They meet somewhere and begin to do it. 10.
10-year-old.
That is as bad. You see, the worrying aspect is that we can say youth. The age of use is dropping. 8 youth. If I take you to certain places in Lagos, you will see the use of substances by a family. They live in the joint. And then they see the father. They see that's where they live. That's how they get access. Look, it is very bad. It is bad.
So now we have seen, wow, how terrible the situation is. Some are saying that perhaps we need to begin by, breaking the chain in terms of, these people who are in the business. But we've seen NDLEA, burn some of these things, the consignment when they get access to them. we see, you know, trying to do something just to dissuade these persons from continuing in the business. But that hasn't really had any much impact.
It goes back to exactly what I said about opulence. The drug business is big business that brings in a lot of money. You know, people said to me, oh, Marwa is making so much money, he's catching people here at the port. Those are couriers. That courier does not know the next level of his boss. So he can't know the baron.
Really?
Oh, absolutely. So you can then imagine people caught at the airport, people are just couriers. And what General Marwa is trying to do, can we break into the baron clique? But it will be difficult.
Why?
Because the baron sits in the office. He's one of the rich men in Nigeria. He's probably one of the big top people who doesn't even know those people carrying those stuff, because the chain is a huge, and until our attempts become collective, and then until we can trust one another with information. If I give authorities information, am I safe? Within the organization, are there moles?
Right.
So it's, look, we can only go a step at a time, and I don't want us to get overwhelmed by attacking all the system. We need to have a lot of intelligence. We need to break the chain of corruption, because Jeremiah just said to some of the graduates from the training and said, look, shun corruption. Look, when somebody comes to a young man who earns 50,000, 70,000 a month and offers him 5 million to change the specimen, unless the person is so hugely
on morality,
forget it. And he says he exchanged it, maybe the cocaine specimen just suddenly turns to a lubo or turns to something no cause. And it's noticeable. The only thing is now on the chain of those people. One day will be caught. As a people, we can talk. You see, the drug issue is only topical because it sits on it sits on stools. The stools we need to dismantle are the things that hold up the drug business.
Which are?
Value system, family system, the way we take issues. Are we observant enough? How many parents know what their children do right in the home?
Right.
So if we don't begin to, you see, I said carelessness the other time. Nigerians are very careless. Let me give you an example. If I leave the studio and they ask someone, what was the color of my shirt? People will wonder, because it doesn't, the only thing that touches is the fancy.
They don't pay attention.
We don't pay attention to details. And so that's why you see in England, you see some women sit behind the window. They call them old women on the street. They can tell you the number of people who pass within an hour. That people call the police. Within 5 minutes, the police will appear. Do we have that here? If you go to certain joints, you see policemen, you see military men in uniform smoking. So tell me, and then when they now come to raid, the raid is just for business. They raid them, then they say, bail yourself. And that's the way the trade goes on.
But we can't continue like this.
We can't. We just need to wake up. Do we understand? Even the House of Rep passing that law, do they understand? They don't. I remember last year or 2 years ago, a senator stood up and said, let the federal government set up rehabilitation centers in every local government. Excuse me? How much does it cost to set up a rehabilitation center? Where is the personnel to man it? To what extent do you want to do it? You see, so those kind of things shows the absolute ignorance of the people, that you have a deeper understanding of what the situation is. If Inwa Juba didn't go to his local government, or people didn't complain to him, when last did he visit his local government area? When last did he visit his constituency? Does he have an office there? Does he have staff there who give him the feedback and who give him the statistics? It's all noise. They will muddy the waters for NDLA. And then we're back to status quo.
Right.
Unless we're systematic and strategic.
But how about state governments that are closer to the people also taking up this fight?
That's the thing. You see, people think, you know, most times in Nigeria, everything is federal.
Right.
Oh, the government, Buhari is this. People forget that the closest segment of government is the local government. If we can dovetail and domesticate some of the things that is being done nationally in the states, and then the states now get into local government. Look, why do we have religious leaders? It's not only to come and make noise about Sharia or something. The issue of substance abuse is worse than religious noise they're making. Why do we have traditional rulers? Why do we have local government chairmen? Some local government chairmen don't live in their council. They live elsewhere. How does it then know what happens in his constituency? So I agree with you. We need to work together. What about Parents-Teacher Association? What about Women Association? If we want to get result, we better work with women. I tell you this from experience. They are most observant. It's the mother that will tell you that I notice my son. The father never notices. I say to most people, when you do Parents-Teacher Association meeting in schools, how many fathers do you see? They don't go. They think the only to do is to provide the money. It is not about that. How many fathers are role models to their children? Role modeling.
Parenting.
These are basic fundamental things. If the churches and the mosques begin to speak about substance abuse, about vices in the society, beyond their daily pontification about Jesus Christ doing this, the Bible speaks to us, we know. But can we make it down to people's lives? That's why people sit in church. They're still groaning. There's no impact. The only thing that makes sense to them is tithe and offering. Someday, there'll be nobody to give the tithe and offering.
If we don't address it.
If we don't address it, because this is extremely fundamental. And that's why I worry. I've been in this fight for years, and I see the deterioration. And I see when people suddenly, hey. When I told an NDLA Director General many years ago, when he was making noise that Nigeria was only a transit nation, I said, no, don't joke. We are already a user nation. Until 2013, NDLA now agreed that we're user nation. Even at that time, we're a producing nation.
Really?
Method research. NDLA has discovered 27 laboratories at least in Nigeria manufacturing it. So what is it? If we continue to sit on interdiction, the drugs can't go out. We domesticate the use of drugs. And so the drugs that can't go out will get used by people here. So it's about sitting down. It's not that I'm making noise about marijuana. I'm saying it because I'm quite involved in his administration. So I know his efforts and I know his pains. And I know how determined. But I've said to him, my fear is this. If we do not put some backends, legislative backends, to what he's doing, one day, I can tell you, the barons are not sleeping. They might get the government to move him. And what happens to his efforts?
They are that powerful.
Oh, look, there was a time, General Noriega of Panama, I think yes, Panama, was head of the kingpins in the Americas. Until he was extradited to America and is in jail. There was a time the head of the Navy in Cape Verde was the kingpin in West Africa. So they're not kids. They're not. So we must know, even the NDLA knows, that if today they decide to pick barons, it won't take long before something bursts. Because they're powerful. I will be surprised. I will not be surprised either that some of the barons in Nigeria are in positions of authority that you never think that is possible.
Right. That's you know, it's a really, really tough one.
It is.
We need that legislative backing, like you have rightly pointed. But we see that in some places they are beginning to take laws into their hands, and I'm wondering how worrying that is for you. In some of the states, we see them flogging some of these abusers, shaming them as well. I mean, is that going to do anything?
It's not going to do anything. It's going to drag the thing under the table. You see, it speaks to the ignorance of the people. If you beat an addict, what does he do? Many times, the people we call addicts, I regret to say, are not addicts. They're functional users. The man who sits to use and he goes to work is not an addict. An addict cannot function without the use of drugs. So we need to know those things. Flogging them for what? You are stigmatizing them. Shaming them for what? You are stigmatizing them. So everybody then finds another area to go and use under the cover of darkness.
So stigmatizing is also contributing to?
Absolutely, it's a major contributing factor. Let me give you this example. When Professor Ransom Kuti was Minister of Health, he came out and said, my younger brother died from the complications of HIV/AIDS. You know what that did? That demystified HIV. And people could come out and do tests and, if Prof said, if we could only have some parents or some top people in this country say, oh, my son, oh, my daughter, this and that, and they look at him and say, oh my God. So people begin to have a change of view. Addicts are not terrible people. I can tell you that from my experience with them. They're probably some of the most intelligent. I've seen it particularly. Look, when you see them, I go to a joint, there's a medical doctor there. He graduated like 8 years ago. He lives in the joint. There are doctors, there are lawyers, there are accountants who live in the joint. Are they terrible? They're not.
There's a whole lot of work that has to be done.
Absolutely.
Obviously.
Absolutely.
And with regards to education and level of awareness, with regards to the downsides to the abuse of drugs, how would you evaluate or rate Nigeria? Quickly.
In 1 to 10 in terms of awareness, I would say about 3. Yeah, I would say about 3 because most people don't know. The only thing they see the devastating effect of drugs on people and then they speak to that. But in terms of advocacy, we need to do more. We need to, one of the things that the NDLEA also is pushing, don't go to schools and begin to talk to young people about drugs directly because you are going to get them to get interested and go try
Curious.
it. The thing to do is to speak to people who relate to them on a daily basis, who can make impact in their lives, like teachers, like parents, like the church, and then that will make better results than just going to school and talking about it.
Students. All right. We'll have to leave the conversation here now. Thank you so much, Executive Director, Christ Against Drug Abuse Ministry, Dr. Dokun Adedeji, for your time.
Thank you very much. Appreciate it.